actually scarily prevalent with our young people. It happens all the time. But, you know, if you're seeing your kid cut, you're going to get freaked out because you know that there's definitely a problem there that needs to be addressed. And something that I look at as a treatment provider, a lot of people don't know this, is really where the cutting is happening on the body. Oftentimes, if the cutting is on the legs, that usually is a sign that there's been some type of sexual trauma. And the arms, you know, if it's the left side or the right side, the left side means something different than the right side because of what parts of the brain it's attached to. So usually when they're cutting on the left side, it's almost like, it sounds like kind of weird, but their abuser kind of attacking the self versus cutting on the right side, which is the self kind of retaliating against the abuser. So it's, as a practitioner, I'm looking at where they're cutting, the frequency that they're cutting. But for the person that's cutting, usually they're trying to, sometimes they're trying to punish themselves, you know, for something that had happened. Sometimes they're trying to, you know, feel something because they're so numb inside that it's like a way of trying to express themselves through the cutting. Parents do need to be alerted that this is, you know, not the right behavior, that their kid is, maybe even have a personality type of issue disorder of some sort, you know, that there's something seriously emotional going on that would cause them to turn on themselves that way and maybe punish themselves and really get the proper help from that. But oftentimes it's not, you know, suicidal. But however, if they cut in the wrong place, accidents do happen, and it can be very, very dangerous. A lot of people will cut on their wrists, and you know, it's very easy to cut a vein there. So parents really need to be alerted to these things, and definitely get help for your child. But it can be helped, and people do get better.